Hi Susanna. I'm going to explain what happens when we suction a patient with a tracheostomy.
Thanks. I don't know much about the procedure.
We suction patients with traches if their respirations are noisy, and they're unable to cough to clear the secretions themselves. That's important to avoid a mucus plug developing. The first thing to do is to explain the procedure and get the patient's consent. Suctioning can be unpleasant, so it's important that patients know you will take as little time as possible, and be as gentle as you can be. Before starting, I'll sanitize my hands and put on clean disposable gloves and an apron, to reduce the risk of cross-infection.
Okay, I get it.
We put the patient in a semi-Fowler's position, and put a pulse oximeter on the patient's fingertip to monitor oxygen levels during the procedure. Next, we check that the suction pressure is safe for suctioning. It shouldn't be more than 20 kilopascals.
Okay, why is that?
It's to avoid trauma to the trachea or windpipe, prevent hypoxia or low oxygen levels and reduce the risk of atelectasis or a collapsed lung.
Right, I see.
Next, open the end of the catheter pack and attach the catheter to the suction tubing. Only touch the catheter pack and keep the rest of the catheter in the sterile packet.
Okay, so, the sterile tip of the catheter stays in the packet?
That's right. The next thing to do is to put on a sterile glove onto my dominant hand so I can hold the sterile suction catheter with this hand. Then I'll take the suction catheter from its packaging, keeping the catheter sterile by holding it with the gloved hand.
What about the other hand? The non-dominant hand?
You can use the gloved non-dominant hand to support the trachea flange as you suction.
Okay.
Now I'm ready to start suctioning. I'll let the patient know I'm about to start and the suctioning may cause some coughing. I'll insert the catheter into the tracheostomy tube until the patient coughs or until I feel some resistance. It's very important to do this without turning the suction on.
Okay, I understand.
Then I'll turn on the suction and gently pull the catheter back in a continuous motion. Remember that we are trying to avoid damage to the tracheal tissues.
Yes, I remember.
Another important precaution is not to suction for longer than 15 seconds. Otherwise the patient's oxygen levels may drop considerably and the patient may feel like they're choking.
That would be awful.
Yes. As I said before, it can be a very unpleasant procedure for patients, so it's important to make it as comfortable as possible. After you finish suctioning, assess whether the patient needs to have some oxygen by checking their oxygen sats.
On the pulse oximeter?
That's right.
What if the phlegm is very thick and can't be suctioned out?
If the secretions are very thick, the patient may need to have some saline nebulizers through a mask over the tracheostomy. Then suctioning can continue.
Right. I understand. Is there anything else I need to do?
When you've finished, flush the suction tubing with tap water. Dispose of any used equipment in a clinical waste bag. Finally, make sure the patient is in a comfortable position and has a cool bell in reach.
Thank you for explaining the procedure to me. I'll make sure I follow your instructions.